Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 2, Internal Medicine, focusing on Hematology and Oncology. Question number 2. For the following case, which of the following cellular processes is most likely impaired due to this patient's gene mutation? A. Co-translational protein targeting to endoplasmic reticulum. B. Initiation of translation. C. Peptide bond formation. D. Ribosomal translocation during polypeptide elongation. E. Termination of polypeptide synthesis. The case scenario is: a 16-year-old girl with a history of anemia since childhood is evaluated for a genetic abnormality after several members of her family are also found to be anemic. It is determined that she has a point mutation in the beta-globin gene, which has resulted in the substitution of guanine with cytosine in the mRNA sequence shown below, plus one position indicates start codon. The question is: which of the following cellular processes is most likely impaired due to this patient's gene mutation? Your options are: A. Co-translational protein targeting to endoplasmic reticulum. B. Initiation of translation. C. Peptide bond formation. D. Ribosomal translocation during polypeptide elongation. E. Termination of polypeptide synthesis. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is B, which is initiation of translation. This question is designed with the focus to assess your ability to apply foundational science concepts. This patient has beta thalassemia due to a mutation in the beta-globin gene just before the methionine start codon, AUG, that is most likely disrupting translation initiation. Eukaryotic translation initiation requires the assembly of ribosomal subunits, 60S and 40S, mRNA, initiation factors, initiator tRNA charged with methionine, and guanosine, 5-triphosphate. The small ribosomal subunit, 40S, initially binds to the 5' cap of mRNA and scans for the start codon, which is positioned near the beginning of the mRNA and is surrounded by the Kozak consensus sequence. This short sequence identifies the specific AUG codon that serves as the initiator of translation, analogous to the Shine-Dalgarno sequence in bacteria. Mutations affecting the Kozak consensus sequence can significantly impair protein translation and have been identified in patients with alpha and beta thalassemias. If you choose any option other than B, you are wrong. Let's briefly discuss the other options. A. Co-translational protein targeting to endoplasmic reticulum. Co-translational protein targeting is mediated by the N-terminal amino acid sequence of an elongating polypeptide. This localization signal is recognized by a signal recognition protein that helps transport the ribosome to the rough endoplasmic reticulum. Mutations affecting the signal sequence would be found after the start codon, AUG. C. Peptide bond formation. Peptide bond formation is catalyzed by peptidyl transferase, an RNA enzyme, ribozyme, that resides in the large ribosomal subunit. A defect in rRNA coding for ribosomes would interfere with this process. D. Ribosomal translocation during polypeptide elongation. During polypeptide elongation, the ribosome moves 3 nucleotides toward the 3' end of mRNA, advancing peptidyl tRNA from the A site to the P site. Translocation is catalyzed by elongation factor 2 and requires GTP hydrolysis. E. Termination of polypeptide synthesis. Termination of polypeptide synthesis occurs at stop codons. Mutations in stop codons or non-stop mutations can result in continued and inappropriate translation of mRNA into the 3' untranslated region, producing an excessively long, non-functional polypeptide. Your take-home message from this question is that the Kozak consensus sequence occurs on eukaryotic mRNA and helps initiate protein translation by identifying the proper methionine start codon, AUG. Have you managed to get the answer? Only click above to move on to the next question if you believe you have the solution. But if you don't get the answer right, you have to watch this episode again. Never forget that comprehension is essential for advancement. With our excellent tools, you can discover the key to acing medical tests, particularly the USMLE. By clicking the like button, sharing this treasure of information, and subscribing to our channel, you can be sure that you and your friends are ready. Recall that all it takes to succeed is one click.